Hi, this is Cynthia Reed, and I am the Senior VP of Marketing and Communications for the Greater Oklahoma City Chamber. I'm really excited to welcome today Dan Mahoney with the Oklahoma City Thunder. Dan, thank you for joining us.
Hi, Cynthia. Thanks for having me. This is a unique opportunity to. I usually talk to you face to face, but this is terrific that the Chamber's able to do this. It's
exactly.
There's no reason we can't stay in contact and keep people engaged.
Exactly. So let's start with where this all started for a lot of us on March 11th at that game where kind of the world turned upside down. Talk about that just a little bit.
Sure. Well, obviously we were getting ready to play the Utah Jazz, and it truly was minutes before opening tip when we got word that one of the Jazz players had tested positive for the coronavirus. And Governor Stitt happened to be at the game that night, and our chairman, Clay Bennett, was at the game. We quickly worked with the health officials from the state health department, contacted Commissioner Silver at the NBA, and the decision was made to postpone the game. Obviously, the number one concern for us was the safety and health of everyone in that building, from fans to players to officials to staff. And that was the key, to get our fans, 18,000 fans, out of the building in a calm, orderly fashion. Our public address announcer made the announcement once we determined with the league that we would indeed postpone the game, made that announcement, and we wanted to make sure people knew they were safe. We couldn't really talk about what the situation was because you have privacy concerns with that player and a few other things. And so the key was to get people out of the building in a safe, orderly fashion, and that occurred. Later, the state health department pretty quickly that night put out a social media message to our fans that if you were a fan that night, you were not at risk. So that was a good message for people to hear. But obviously, that sort of began the situation, particularly within the sports world. The NBA announced that night that they would suspend the season for 30 days. And obviously, we're still in that suspension. And in terms of the future, we just don't know. Obviously, the NBA, like everyone else, wants the situation to be safe for all before we resume any sort of events.
So what has this time been like for the Thunder organization, and what have you guys been up to in the interim when there's no basketball?
Well, our staff has stayed very engaged. We are like everyone else, working from home. The office is closed and has been for weeks. We're staying busy. We're communicating. We're doing a lot of longer range planning. We're doing a lot of contingency planning for all kinds of things. But we're also very active in the community. As you know, Cynthia, that's one of the strong priorities of the Thunder from our chairman, Clay Bennett, on down, is to be very involved in this community. And this situation hasn't slowed us necessarily. We wanted to be active and involved and help during a time of crisis, because obviously that's what this is. What we bring to the table, we think, and did after the tornadoes of 2013, is the reach that we have. So immediately we began working with a lot of our community partners, particularly also our corporate partner, OU Medicine, but also the City County Health Department, the State Health Department, the Food Bank, all of the community partners that were thrown into action very quickly in the middle of this. And we bring the reach that we have, our Twitter account, our Facebook account, to be able to get those public health and public safety messages out there. And that's what we did. As we move forward, we partnered with a number of those community partners. Again, I'll mention OU Medicine. They're obviously right in the middle of this with a very important public health message. Pretty early on, we did a Facebook Live with Chuck Spicer, their CEO, and they're the head of their infectious disease department, and talked about the public health messaging, not just from OU Medicine standpoint, from in general, the general standpoint, to make sure that people knew the facts. There's a lot of information flowing all the time, and we really wanted to stay very factual, and that even those messages have changed. I mean, in the 5 weeks since we did that, that's the incredible thing about this. Things are changing, and we try to, so we're trying to stay on top of it. But again, using the reach that we have, we've also worked with Devon Energy. Devon stepped in, and we have a surplus of T-shirts that we've collected over the years, and so we made the decision, working with Devon, to turn those T-shirts into masks for the community. So we've been able to distribute those to a wide variety of community partners, agencies, healthcare, retail, we really want, they're basically T-shirts, some single ply, some double ply, and the CDC recommendation is that you wear the mask. And so the T-shirts became masks. We're proud of that. We think that, and again, thanks to Devin for making that happen. We're just trying to meet the needs of the community, doing the best we can. It is so, like everyone, it's so strange for us because everything we do normally is external, basketball games and community events and everything's out in the public. This obviously is the inverse of that. And so like everyone else, it's been a process to adapt to it, but we've stayed very busy, and our players have been active. Danilo Gallinari a few weeks ago donated money for tests, coronavirus tests for the community, and they did 400 tests with that, City County Health Department. So our players are sitting back, waiting to see what happens. Obviously, they're basketball players. They want to play basketball. We're a basketball team. We want to play basketball. We'll just have to see what the future brings. But the key thing is make sure everybody's healthy in the process.
Dan, you and I have known each other a long time, and your career, we've been through more than one disaster as a community, and some of which you've been right in the middle of. Tell me how that's maybe helped prepare you for this event and what we're experiencing right now.
Well, it has. I mean, I worked for Governor Keating during April of 1995. I just started in the governor's office. I worked in TV and radio news before that for a long time, and that kind of prepares you for thinking on your feet. Yeah, as you know, being in the community for so long, we got a lot of questions about what's your crisis management plan? What's your crisis communications plan? And, you wish you had the plan all easy. You just pull it off a shelf and implement it. Obviously, it's not that easy. To me, the best crisis management, particularly in communications, is in the hiring process. When you're hiring people, to bring people in that can think on their feet, that can think quickly, that keep it together, and that's hard. This situation in particular is very hard. You don't want people to be robots either. You want people to feel it, to be involved in the discussion of it all, but you really want people that can think on their feet and react well in the moment to make sure that you're adapting to ever-changing situations and facts. And to me, that's pretty key, and is in the hiring process.
Makes a lot of sense. So have you made any special memories during this time?
Well, my youngest daughter recently in February moved home from New York City. She went to school there. She spent a couple of years after graduation there. New York City kind of got the best of her. She wanted to come back to Oklahoma, which I was thrilled with that idea. So she came home, and in the meantime, she's living with me, which came exactly the right time. So we've made some good memories. We just adopted a dog. I mean, so yeah, you're going to make the best of this situation, like everybody. It's difficult. It's I'm healthy, and that's the key, and my daughter's healthy, and that's the main thing. We're staying safe, but not everybody has been that fortunate, and so it's been difficult. I think a lot of people are gonna come out of this with a lot of learnings and a lot of things moving forward in the business community. I know on our business side of the business, we're going to do more of these video calls, even when this is all over. We have a lot of people who are remote, scouts, business people, other people. We travel a lot, that sort of thing. We're going to maintain this visual eye-to-eye contact in our meetings. It's been helpful. So yeah, I think we're also kind of working on a program to help honor the class of 2020, all the graduates that are missing their commencements from kindergarten through law school. It's going to be a difficult process to miss that ceremonial sort of closure to their education at different levels, but we think that it's actually a group that we want to honor. The class of 2020 is actually going to step into the real world prepared with having gone through such a situation. So be looking for that. We're going to do some cool things, we think, to help honor the class of 2020.
Well, maybe we can do this again when you're ready to launch that.
Absolutely.
Any other final thoughts or things you want to make sure people know about what's going on with the Thunder right now?
No, as I said, we're really proud of the community and corporate partners that we have, especially a company like Devin, that's been with us since day one as a founding partner. They're obviously going through challenges as well in that industry, and for them to stay connected to us, to be able to do these things in the community with the masks, turning the T-shirts into the masks. A partner like OU Medicine that is just obviously having a lot of challenges right now in the
In the
health
middle of
field
it, right.
yeah, and to stay connected to them, to help the community. We really appreciate that level of support.
Well, thank you very much, Dan. This was great.
Thanks, Cynthia.
Always great to talk to you, and we'll look forward to next time.
Okay, thanks.